Hi Emily, today we're going to be going through the pre-exercise screening. Okay, this is going to be stage one of it. Basically, the aim is just to find out, get a bit of a gauge on your health. Okay, to see if there's any known disease or signs and symptoms of disease, to see if you're at any kind of risk. Prior to us undertaking a bit of an exercise program, so I can refer you to any kind of professionals if need be. Okay. So this is completely confidential and private. Okay. If you don't feel comfortable at any point, you don't have to answer any of these questions. Okay. And we can make different arrangements and that kind of thing. So this will be completed by you, and we'll go through the questions together. If you have any more questions about anything, please feel free to ask me, and I'll clarify. Okay. Or any other exercise professionals if you feel more comfortable. Okay. But yeah, basically we're just going through to make sure there's no underlying, we won't have any adverse health reactions to anything we do going forward, okay? So I'll get you to just write your name, which would be Emily Webster, correct?
Yeah.
So what was your date of birth for me?
7th of May, 1997.
Okay, beautiful. I'll get you to just write that underneath your name. Magic. Then I'll just get you to tick female for me.
Thank you.
Okay, so first question, okay. Has your medical practitioner ever told you that you have a heart condition or have you ever suffered a stroke? No, that's a good thing. Can we just tick no for me?
Yeah.
Okay, so number two, do you ever experience unexplained pains or discomfort in your chest at rest or during physical activity exercise? So that's
No.
more referring to, as you can imagine, your heart, not just feeling soreness from your muscles, but your actual, you can imagine the discomfort. Yeah, you don't
No.
experience that,
No.
no? Okay, so number three, do you ever feel faint, dizzy, or lose balance during physical activity exercise? No, no problems. Give that a tick. Have you had an asthma attack requiring immediate medical attention at any time over the last 12 months? No? Okay, give that one a tick for me, please. If you have diabetes type 1 or 2, have you had trouble controlling your blood sugar in the last 3 months? Do you have diabetes?
No.
Okay, we'll give that one a tick. And lastly, do you have any other conditions that may require special consideration for you to exercise? Beautiful. Give that one a tick. So basically, now that we've got that, we can start moving forward. It's good that you've answered no to all these things. So if you've answered no to all these, we're going to go forward to question 7. We'll just do a rough calculation of your typical physical activity per week. So can you just, for me, in a typical week, describe your physical activity frequency and duration and the different intensities? Okay, so just here we have number of sessions per week, so and the duration, and then the total will work out. So do you just want to fill that one for me?
Yeah.
So just have a read through it if you need to.
Yeah. Okay.
So if you do, maybe you
So
do.
what would be considered light?
So light would be probably just going for a nice brisk walk here and there. Not really, as I believe if you was a PE teacher, you'd probably be doing quite vigorous to high activities on the day you go to gym. But also when you don't, it's probably more moderate. So it's up to you. You also have netball training, I believe. So just do your best. So for more information, sorry, yeah, if your total's less than 150 minutes per week, then light to moderate intensity is recommended. Increase your volume, intensity slow. So what this is, we're just getting a gauge. We know to increase or decrease it. Okay, so just fill it out as best you can. Keep in mind, this isn't a bad thing. It's just so we have a bit of a platform to work on. So yeah, it's probably good if you're just doing some moderate, so that you're not at risk of overtraining that way. Yeah, beautiful. So all up, that'd be about 220 minutes per week. So do you want to put that one in there for me? I think that's a good base rate. We can definitely work on that and go somewhere with that. Thank you. Can you just sign the bottom that that all this information is correct that you just filled in? Thank you. The date is the 8th of the 3rd.
Thank you.
No problem. Okay, so we're nearly there, Emily. Thanks. So I'm happy to move on from stage 1 because you've answered no to all these questions, which is really good, as I said before. Okay, so we'll now go on to looking at some exercise intensity guidelines. As I said before, This is our light kind of exercise, 40 to 55% of your heart rate max. Okay, very light. So light up here, 1 to 2. Okay, then we have our moderate, our vigorous. As we can see, it goes up. Okay, um, and I'm sure being a PE teacher, you know all about this. Okay, beautiful. So then we can jump on to stage 2. Okay, so we're just going to put your age in here for me. Then just your gender here for me. So as we can see, you're 23. Okay, so the risk of an adverse event increases with age, particularly in males, which doesn't concern you, above 45 years, and females above 55 years. Okay, so 23, perfect. If you have any family history of heart disease, would we please put it down here? Nothing. So do you want to just put it not available for me? So that's really good to see. So a family of heart disease obviously can sometimes be put you in a bit of a position where you might be genetically predisposed. So yeah. Do you smoke cigarettes on a daily or weekly basis?
No.
Awesome. Do you just want to click no for me? Okay, so as we all know, okay, smoking is going to have a lot of negative health effects. It might affect your training going forward. We might have to look at some things in your program. It's really good that you're not smoking. So roughly, if you know your weight and height, could you please put it in there for me?
I think I'm around 60. 75.
Okay. Do you roughly know from last time we checked, even though we might not use this anymore so much as we used to, your BMI? No, that's okay. We'll just leave that one out. We'll come back to that one. What do you think your waist circumference would be? So roughly, what size jeans do you wear?
No, I'm not even sure.
That's okay.
Might have to measure it.
That's okay. We'll come back to that one and we'll do that. Have you ever been told that you have high blood pressure?
No.
Okay, just tick no for me. Okay, are you taking any medication while you don't have high blood pressure? So that would be no. Thank you. Have you been told that you have high cholesterol or blood lipids? No. So just again, just tick no for me. Beautiful. Thank you. So that we're just going to follow on with our stage 2. Okay, so same again. Have you been told that you have high blood sugar?
No.
Okay, for me. And that one, so that's just looking at our increased what risk we are of diabetes. Okay, are you currently taking prescribed medication for any conditions? Yeah, yes, no, beautiful. So, no. Okay, have you spent time in hospital for any condition, illness, injury during the last 12 months?
No.
Okay, beautiful. So that's just looking at obviously if there's prior injuries that we need to be aware of. Okay, so going forward, if something might be a bit more susceptible to injury if you've injured it previously, but it's good to see that you haven't done that and let's keep out of trouble. Beautiful. Have you ever given birth or been pregnant in the last 12 months?
No.
Okay, so let's give that one a tick for me. So obviously that would also alter your the way your body works and moves, and we'd have to make some changes. Do you have any diagnosed muscle, bone, tendon, ligament, or joint problems that you've been told could be made worse by participating in exercise?
No.
Okay, awesome. Just give that one a tick for me. Okay, so sometimes if there was problems there, someone might experience a bit more pain. There might be certain movements you might want to stray away from. Okay, so basically that is the end of the stage 1 and 2 screening. Okay, are you happy for me to use what you've told me here to kind of inform going forward your program?
Yeah.
Okay, beautiful. Thank you for doing that for me, Emily.
Okay.